everybody. My name's Julia Paget. I'm the clinic director here at Complete Fertility. I'm delighted today to be talking to our Dr. Katie Hodgkinson, who is a specialist GP in lifestyle medicine with a special interest in hormone imbalances. And she's going to tell us all about how she can help our group of patients, our fertility patients. So Katie, why don't you tell us all the things that you can do to help with our patients?
Hi, well, thank you for having me on here. So my name is Dr. Katie Hodgkinson. I am a GP. I am a lifestyle medicine physician, as Julia said. So, and I specialise in hormones. So I see patients with a variety of different conditions, mostly centred around hormone imbalances. And a lot of the time what I'm doing is advising on diet and lifestyle, because we know it plays such an important role with balancing hormones. We know that stress is a massive factor with hormone imbalances. And obviously hormone imbalance is a big factor if somebody is trying to conceive as well. So there are ways that you can help support your hormones through diet and lifestyle. So it's basically advising patients on that and guiding them and helping them to get more of a balance, to get themselves in a better position. You know, talking about fertility in terms of helping to optimize their health when they're trying to conceive.
That's great. So if a patient were to ask to see you, how would an appointment run? What kind of things would you talk about? What direction would it go?
Okay, so usually it's a 1-hour consultation initially. So that's most of it's sort of fact finding. So find out about the patient, so medical history, talking about periods, talking about any family history, and really delving a lot into lifestyle and diet and lifestyle, talking about stress as well. So the first part is talking about their history. Then I discuss about hormone cycle, different hormones which can affect mood and symptoms that they may be getting, and the effect of stress on hormones. So it's discussing that with patients, educating them about how important it is to have hormone balance. And at that point we'll discuss testing, so to explore this further. Usually it comes in the form of blood testing. Sometimes I might offer a salivary test, for example, looking at a detailed cortisol check, so one of our stress hormones, because we know that cortisol is often a driving factor with hormone imbalances. So discussing that with them, and then once we have the results back, then it's a 1-hour detailed chat, discussion about the results, going through both tailored and generic diet and lifestyle advice to help the patient going forwards. I do sometimes suggest supplements as well, often, you know, talking about prenatal vitamins, for example, to help support someone who's trying to conceive. And then I may follow them up at a time a bit later on just to see how they're getting on.
That's great. Yeah. So I know that a lot of our patients have really specific needs. For example, you know, polycystic ovarian syndrome, something that comes up a lot with our patients, and they have really particular worries about irregular periods, acne, facial hair, things like that, or excess body hair. Is there anything you can do to help them?
Okay, so obviously that's something that would come up quite a lot with fertility issues. Sometimes patients are only diagnosed with PCOS when it comes to the point they're trying to conceive. So they may not always be obvious that they've got PCOS, polycystic ovarian syndrome. There is a massive link with what's happening with diet and lifestyle and polycystic ovarian syndrome, particularly with weight issues. We know that one of the main factors with helping PCOS is trying to reduce the weight, regulating blood sugar. So absolutely there are things that can be done to help with PCOS patients, and helping with hormone balance.
That's great. So again, around weight, you know, the body mass index is a big deal for our patients. As you know, with not just with NHS funding, they have to be between a range of 19 at the lower end and up to 30 at the higher end. And some of our patients do waver around the sort of 31, 32 mark and really struggle to get under, but also the patients on the lower end feel that they feel a bit sometimes unsupported because they're desperate to get their BMI up and feel that they're in a different group, and that perhaps there's not so much attention for the people that struggle to get the weight up. Is there anything you can do to help them?
Yeah, I mean, I think you know, a lot of the factors. So if somebody is underweight, then it's exploring any issues around food, if that's an issue. So if they have any eating disorders, if they're exercising too much, exploring if there's any sort of psychological issues around that. On occasion, I may refer to other specialists, for example, a dietitian, to explore that, to try and get the weight up to a normal range. And then, advising again on diet and lifestyle and support. So, on occasion, it may be that perhaps a referral to a psychologist is required to help with any issues surrounding that. So, yeah, I mean, it's a difference of slightly different management to somebody, say, who's trying to lose weight. Principles of hormone balance are similar in a way, but there may be different specialists that we need to assist and work alongside myself to help with that.
So what with the higher BMIs, what do you do with the people that are trying to lose weight?
Well, a lot of it's to do with, yeah, absolutely diet and lifestyle, but we do know that in terms of factors with what actually drives there to be a weight issue, they might have been trying to lose weight, doing all the sensible things, healthy eating and exercising, but still not losing weight. And it's exploring why that might be. So, is there too much stress? Do they have perhaps something called insulin resistance? Is there an imbalance between estrogen and progesterone, or some other hormone imbalance that's going on? So it does depend on the cause. Not everyone is the same in terms of why they have issues with weight. So it's exploring that. So each person will have a different management plan, although there is generic advice, but obviously every bit of advice needs to be tailored to that patient depending on what the cause is.
Yeah, it's nice. It's really personalized.
Yeah.
And what about, so many of our patients are obviously stressed. I mean, life is stressful anyway, and you throw in, you can't have a child. That's extremely stressful. Is there anything specific you can do around stress?
Yeah, I mean, stress is a massive driver of hormone imbalance. It's one of the big causes. And stress is not just emotional stress, it's what we're eating, it's lack of sleep, it's lack of downtime. People don't always realise that if they're having a lot of sugar or alcohol, whatever, that can create stress in the body. So it's exploring those aspects. So exploring the emotional stress, exploring what they're eating, help with sleep, help with relaxation, discussion about exercise. It's just, and again, it depends on each person. So, if somebody has got a chronic, long-standing stress, a lot of cortisol, then something, excessive exercise might actually be making the problem worse. So it's just exploring what their source of stress is, whether it's long-standing, and just working together with them to give them some guidance in terms of how to help that.
Okay, that's great. Is there anything else you want to talk about before we look at some questions? Any other kind of?
I think it's just really just making the point that how important diet and lifestyle is about really just helping to address hormone imbalances. It really can play a massive role. And I think it's just important to hone that point that, it doesn't matter what stage you're at in terms of talking about fertility, whether you're trying to conceive and having difficulty, or you're thinking about having a baby in the future and wanting to get your body into more of an optimal level. It's just important to factor in diet and lifestyle. The other thing that I haven't talked about is gut health as well. So we do know that, it's a massive area of research, particularly in the last few years, just how important having a healthy, happy gut microbiome, the microbes in our gut, is for many aspects of our health, but especially with hormone balance. We do know that from research there is a link between what's happening in our gut and our hormones and our stress levels as well. We know that there's something called a gut-brain axis. So what's happening with our gut can also impact on our mental health as well. So, so that's another important factor to think about too.
That's great, thanks. Okay, so let's have a quick look at some questions. Some questions have come in, so I'm going to read some out. I can see, so somebody's asked if, because they've gone through early menopause. Hi, I've gone through early menopause, and I'm wondering if there's anything that you can do to help around that as I'm going through fertility treatment.
Right, okay. I mean, early menopause and fertility, so it's quite a difficult way to sort of, if you're thinking about fertility treatment. So there are sometimes specialists that you might need a referral to. There is some evidence, say, that acupuncture may help. It's addressing the stress aspects with the fact that somebody's going through early menopause and then wanting to try and conceive. Obviously the psychological aspects of that, the fact that if they're no longer ovulating and how that's impacted on them, but also impacting on the fact that if they go through early menopause, they have other increased risk factors, say for example with osteoporosis or heart disease once they've gone through early menopause. So there are other aspects that need to be explored in terms of supporting bone health and supporting any symptoms they might have to do with the early menopause. So yeah, I mean that's in itself, going through an early menopause has its own psychological aspect, but then coupled with if somebody's trying to conceive as well, then yeah, it's just managing those factors.
Okay. The second question is quite interesting. It says I'm in treatment for a second child, so they've already got a child from fertility treatment. If I get pregnant, is there any nutritional advice during pregnancy?
Yeah, absolutely. I mean, a similar sort of principles. I mean, there are different demands when you are pregnant. Thinking about making sure your iron stores are good. Often iron can become depleted during pregnancy. Getting some plenty of calcium in your diet as well. So there are certain nutrients which you require more when you're pregnant, but it's also in terms of healthy diet and energy levels as well. Often it's time where you feel very tired during pregnancy, so it's just again lifestyle aspect as well, making sure you're getting enough rest. So yeah, there are certain specifics with nutrition during pregnancy, absolutely, and also supporting yourself with a prenatal or a vitamin, and certain nutrients may need to be supplemented during pregnancy. Even if you've got a healthy diet, sometimes it's worth just beneficial just to supplement with extra nutrients there.
That's good. I mean, I think we always think for our patients they're not pregnant and they're trying to get pregnant. So we really focus at Complete Fertility about helping them get pregnant. But of course, many of them do get pregnant because that's what we're here to do. So it's great to know that they can also use your service once they're pregnant to support them through that process as well, isn't it? And the last question I've got here is just how much are your costs? Do you want me to answer that for you, Katie?
Do you mind?
So I can tell anyone how much the charges for seeing Dr. Hodgkinson. It's £200 for first appointment, where she does a full medical review. The second appointment is for 1 hour, and that's £150. And then any further follow-ups are for half an hour, and they're £100. On top of that, she may ask for blood tests, and all of those blood tests are charged on an individual basis from our blood price list. But that's all of our questions. Is there anything further we need to cover, Katie?
No, I don't think so. I mean, I think, obviously if people would like to know more, then I'm happy to answer their questions. If they wanted to speak to me, they can get in touch with your clinic if they wanted an initial chat about what I do. Yeah. So
that's great. Yeah, there's if anyone needs to get in touch, the inquiry line's info@completefertility.co.uk, and we've got a website page devoted to Dr. Hodgkinson as well, so you can see more about her there. But thanks very much, Katie, for your time. It's been lovely to chat to you, and look forward to seeing you in the clinic soon.
Thank you.
Thanks. Bye-bye.
Bye-bye.